CEN Written Exams Illinois. Question 1. A patient with DKA, diabetic ketoacidosis, has a blood glucose of 500 mg/dl, pH 7.2, and bicarbonate 14 milliequivalent/L. The CEN should anticipate: Option A for insulin bolus. Option B for normal saline and insulin drip. Option C bicarbonate infusion. Option D potassium replacement. The correct answer is option B. For normal saline and insulin drip. DKA management includes for normal saline fluid resuscitation, continuous for insulin infusion, and monitoring of electrolytes, especially potassium. Bicarbonate is not routinely recommended unless pH 7.0. Potassium depletion is common and should be monitored and replaced before insulin treatment, as insulin drives potassium into cells. Insulin is given as a continuous drip, not a bolus. Question 2. A patient with a severe asthma exacerbation is not responding to continuous bronchodilators and systemic steroids. The CEN should: Option A administer magnesium sulfate. Option B prepare for intubation. Option C administer Heliox. Option D administer epinephrine. The correct answer is option B. Prepare for intubation. Refractory severe asthma may progress to respiratory failure. Magnesium sulfate is a second-line treatment that may help, but if the patient is in impending respiratory failure, exhaustion, confusion, silent chest, intubation is needed. Heliox is a rescue therapy for some patients but not first line. Epinephrine may be given for anaphylaxis but not asthma. Question 3. Which law requires screening and stabilization of patients in the ED, regardless of ability to pay? Option A HIPAA. Option B EMTALA. Option C OSHA. Option D ACA. The correct answer is option B. EMTALA. The Emergency Medical Treatment and Labor Act, EMTALA, requires that anyone coming to an ED must be screened and stabilized, regardless of their ability to pay. This applies to all hospitals that participate in Medicare. Patients cannot be transferred without being stabilized, unless medically indicated. EMTALA ensures access to emergency care for all. Question 4. A patient with a suspected fracture has a pulse that is absent. The CEN should: Option A apply a splint and reassess. Option B apply a tourniquet. Option C reduce the fracture. Option D call for an orthopedic consult. The correct answer is option A. Apply a splint and reassess. If a fracture is suspected and the pulse is absent, the CEN should apply a splint to align the bone and reassess the pulse. If the pulse returns, the circulation is likely adequate. If the pulse remains absent, it may indicate arterial injury, requiring an orthopedic and vascular consult. Tourniquets are for bleeding control, not for absent pulses. Reduction is done by a physician, not by the CEN. Question 5. A patient with a suspected globe rupture should: Option A. Have the eye patched and the patient placed NPO. Option B. Have the eye examined with a slit lamp. Option C. Be given 4 antibiotics. Option D. Be discharged with a follow-up. The correct answer is option A. Have the eye patched and the patient placed NPO. Globe rupture is a surgical emergency. The eye should be patched with a shield, not pressure, to prevent further injury. The patient should be NPO for possible surgery. Ophthalmology consult is needed. Slit lamp examination should be done cautiously if a rupture is suspected. Antibiotics may be given prophylactically. Discharge is contraindicated. Question 6. A patient with asthma exacerbation is on continuous albuterol and ipratropium nebulizers, systemic steroids, and magnesium sulfate. Despite treatment, the patient's SpO2 drops to 85%, and the patient is becoming lethargic. The CEN should anticipate: Option A BiPAP. Option B, intubation and mechanical ventilation. Option C, heliox therapy. Option D, chest tube insertion. The correct answer is option B, intubation and mechanical ventilation. This patient is in impending respiratory failure due to severe asthma, lethargy, hypoxia despite maximal therapy. Intubation is required. BiPAP may be tried but is often ineffective in severe asthma with obstruction. Heliox is a rescue therapy but not first line. Chest tube is not indicated. Question 7. A patient with a migraine presents with a unilateral throbbing headache, nausea, photophobia, and phonophobia. What is the first-line treatment? Option A, triptan, sumatriptan. Option B, acetaminophen. Option C, morphine. Option D, metoclopramide. The correct answer is option A, triptan, sumatriptan. Triptans, 5-HT1B/1D receptor agonists, are first-line agents for acute migraine, especially when the patient presents early. They are effective at aborting the headache. Acetaminophen and NSAIDs are for mild headaches. Metoclopramide is an antiemetic that may be given as an adjunct for nausea. Morphine is not recommended for migraine due to poor efficacy and risk of medication overuse headache. Question 8. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50ths mmHg? Option A, atrial fibrillation with rapid ventricular response. Option B, supraventricular tachycardia, SVT. Option C, ventricular tachycardia with a pulse. Option D, atrial flutter with 2:1 block. The correct answer is option C, ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario. Question 9. A patient with cyanide poisoning, from smoke inhalation, presents with confusion, dyspnea, and a normal SpO2. The CEN should anticipate. Option A, sodium thiosulfate and hydroxycobalamin. Option B, oxygen only. Option C, naloxone. Option D, atropine. The correct answer is option A, sodium thiosulfate and hydroxycobalamin. Cyanide poisoning often occurs with smoke inhalation. Symptoms include confusion, dyspnea, seizures, and lactic acidosis. SpO2 may be normal because oxygen is not utilized by the tissues. Hydroxycobalamin, vitamin B12A, is the first-line antidote, binds cyanide to form cyanocobalamin. Sodium thiosulfate is a second-line agent. Oxygen is supportive. Question 10. A patient presents with a sudden onset of flashes of light, floaters, and a curtain over their vision. Which diagnosis is most likely? Option A, retinal detachment. Option B, central retinal artery occlusion. Option C, acute angle closure glaucoma. Option D, vitreous hemorrhage. The correct answer is option A, retinal detachment. Retinal detachment presents with flashes of light, photopsia, floaters, and a curtain or shadow over the visual field. It is an ophthalmic emergency requiring immediate ophthalmologic referral. Treatment includes surgical repair, pneumatic retinopexy, scleral buckle, or vitrectomy, to reattach the retina. Question 11. A patient with thyroid storm presents with fever, tachycardia, and confusion. Which medication is used to reduce thyroid hormone levels? Option A, propylthiouracil, uracil, PTU. Option B, methimazole. Option C, propranolol. Option D, all of the above. The correct answer is option D, all of the above. Thyroid storm is managed with medications that block thyroid hormone synthesis, PTU or methimazole, and beta blockers, propranolol, to control symptoms, tachycardia, tremors, hyperthermia. PTU is preferred because it also blocks the conversion of T4 to T3. Cooling, 4 fluids, and dexamethasone are adjuncts. The CEN should anticipate ICU care for these patients. Question 12. A patient with a history of opioid use disorder presents with respiratory depression and constricted pupils. Which medication should the CEN anticipate? Option A: naloxone, Narcan, 0.4 mg 4. Option B: flumazenol, romazicon. Option C: naltrexone. Option D: buprenorphine. The correct answer is option A. Naloxone, Narcan, 0.4 mg 4. Naloxone is the opioid antagonist used to reverse opioid overdose, which presents with respiratory depression, pinpoint pupils, and decreased consciousness. The dose may be repeated if there is no response. Flumazenol is for benzodiazepine overdose. Naltrexone and buprenorphine are used for maintenance therapy, not reversal. Airway management is the priority. Question 13. A patient with a nasal fracture presents with epistaxis. The CEN should: Option A: have the patient pinch the nose and lean forward. Option B: have the patient lean back to prevent bleeding. Option C: insert a nasal packing. Option D: apply a cold compress. The correct answer is option A. Have the patient pinch the nose and lean forward. The first step for anterior epistaxis, nosebleed, is to have the patient pinch the nose, applying direct pressure, and lean forward to prevent blood from flowing down the throat and causing aspiration or nausea. If this fails, nasal packing, anterior or posterior, may be needed. Cold compress may be used as an adjunct. Posterior epistaxis is a more serious presentation that may require ENT consultation. Question 14. A patient presents with a severe headache, nausea, and vomiting. The patient has a history of hypertension. Which finding would suggest a subarachnoid hemorrhage? Option A: a sudden, severe headache, thunderclap, and nuchal rigidity. Option B: gradual onset headache. Option C: blurred vision and photophobia. Option D: focal neurological deficits. The correct answer is option A. A sudden, severe headache, thunderclap, and nuchal rigidity. Subarachnoid hemorrhage presents with a sudden, severe thunderclap headache, often described as the worst headache of my life. Nuchal rigidity, neck stiffness, is a classic finding. CT head is the initial diagnostic test. Gradual onset suggests a different etiology, e.g., migraine. Focal deficits may suggest an ischemic stroke or mass lesion. Question 15. A patient presents with sudden, severe, and sharp pain in the right lower quadrant, nausea, and vomiting. Rebound tenderness is present. The CEN should suspect: Option A: pancreatitis. Option B: appendicitis. Option C: diverticulitis. Option D: ovarian cyst. The correct answer is option B. Appendicitis. Appendicitis typically presents with periumbilical pain that migrates to the right lower quadrant, McBurney's point, anorexia, nausea, vomiting, and fever. Rebound tenderness and guarding suggest peritoneal irritation. CT scan with contrast is the diagnostic test of choice. Surgical consultation is needed promptly to prevent perforation. Question 16. A patient with septic shock has been fluid resuscitated with 30 ml/kg of crystalloid but remains hypotensive with a MAP of 55 mmHg. The CEN should anticipate: Option A: additional fluid bolus. Option B: initiation of vasopressors, norepinephrine. Option C: broad-spectrum antibiotics. Option D: central line placement. The correct answer is option B. Initiation of vasopressors, norepinephrine. In septic shock, if the patient remains hypotensive, MAP 65 mmHg, after adequate fluid resuscitation, 30 ml/kg, vasopressors, norepinephrine, are indicated. Norepinephrine is the first-line vasopressor for septic shock. Broad-spectrum antibiotics should be given within 1 hour of sepsis recognition, and a central line may be needed for vasopressor administration. Question 17. A patient presents with acute chest pain, shortness of breath, and a pericardial friction rub. Which ECG finding is most characteristic? Option A, ST segment elevation in all leads. Option B, PR segment depression and diffuse ST elevation. Option C, Q waves in leads 2, 3, AVF. Option D, tall, peak T waves. The correct answer is option B. PR segment depression and diffuse ST elevation. Pericarditis is inflammation of the pericardium, presenting with acute chest pain, pleuritic, better leaning forward, a pericardial friction rub, and diffuse ST segment elevation, often concave upward, with PR segment depression. It is distinguished from STEMI by the lack of reciprocal ST changes and the diffuse nature of ST elevation. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 18. A patient presents with testicular pain, dysuria, and a fever. The testicle is tender. Which diagnosis is most likely? Option A, testicular torsion. Option B, epididymitis. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Epididymitis. Epididymitis is inflammation of the epididymis, often due to infection, UTI, ST. It presents with gradual onset of testicular pain, swelling, tenderness, fever, and sometimes dysuria. It is differentiated from torsion by gradual onset, versus sudden, and presence of fever. Doppler ultrasound shows increased blood flow in epididymitis, versus decreased in torsion. Treatment includes antibiotics and NSAIDs. Question 19. A patient presents with epigastric pain radiating to the back, nausea, and elevated lipase. Which diagnosis is most likely? Option A, gastritis. Option B, pancreatitis. Option C, cholecystitis. Option D, peptic ulcer disease. The correct answer is option B. Pancreatitis. Acute pancreatitis presents with epigastric pain radiating to the back, nausea, vomiting, and elevated lipase, 3 times the upper limit of normal. Common etiologies include gallstones and alcohol use. Management includes 4 fluids, pain control, NPO status, and treatment of the underlying cause. Question 20. A patient with suspected measles should be placed on which type of precautions? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions. The correct answer is option A. Airborne precautions. Measles is highly contagious and transmitted via airborne particles. Patients with suspected measles should be placed on airborne precautions in an AIIR with negative pressure. Staff should wear an N95 respirator. Droplet precautions are for influenza, pertussis, and meningitis. Contact precautions are for MRSA, VRE, and C. diff. Measles requires airborne isolation. Question 21. A patient with an asthma exacerbation has a peak expiratory flow rate, PEFR, of 40% of predicted. Breath sounds are quiet, and the patient is using accessory muscles. The CEN should recognize this as Option A, mild exacerbation. Option B, moderate exacerbation. Option C, severe exacerbation. Option D, life-threatening asthma with impending respiratory failure. The correct answer is option C. Severe exacerbation. A PEFR of 40 to 50% of predicted indicates a severe asthma exacerbation. Signs include dyspnea at rest, use of accessory muscles, and quiet breath sounds. Treatment includes continuous nebulized beta agonists, ipratropium, systemic steroids, and consider magnesium sulfate. A PEFR 33%, confusion, or a silent chest indicates life-threatening asthma, which may require intubation. Question 22. A patient with a suspected myocardial infarction has a cardiac arrest. The ECG shows ventricular fibrillation. After the first defibrillation attempt, what is the next step? Option A. Resume CPR immediately for 2 minutes. Option B. Administer epinephrine 1 mg 4. Option C. Administer amiodarone 300 mg 4. Option D. Check a pulse. The correct answer is option A. Resume CPR immediately for 2 minutes. After defibrillation for VF/pulseless VT, the ACLS algorithm directs an immediate return to CPR for 2 minutes, 5 cycles, before checking the rhythm and pulse. Epinephrine is given after the second shock. Amiodarone is given after the third shock. High-quality CPR is essential for outcomes. Question 23. A patient has a cut from a knife that is 2 cm deep and located on the palm of the hand. The CEN should: Option A. Irrigate and suture the wound. Option B. Check for tendon and nerve function. Option C. Apply a pressure bandage. Option D. Administer antibiotics. The correct answer is option B. Check for tendon and nerve function. Deep lacerations on the palm are at high risk for tendon or nerve injury. A thorough neurological and functional assessment is essential to identify any deficits. The wound should be irrigated and may be sutured, but only after the assessment. Antibiotics are not routinely given for wounds unless infected or high-risk animal bites. Pressure bandages are for bleeding control. Question 24. A patient with a suspected overdose of opioids has a respiratory rate of 6 breaths/min. The CEN should: Option A. Administer naloxone 0.4 mg 4. Option B. Administer naloxone 2 mg 4. Option C. Administer naloxone 0.4 mg IM. Option D. Administer a naloxone drip. The correct answer is option A. Administer naloxone 0.4 mg 4. Naloxone is the opioid antagonist used to reverse respiratory depression in opioid overdose. The standard initial dose is 0.4 mg 4. If there is no response, the dose may be repeated. Naloxone can be given IM or intranasally if 4-access is not available. The CEN should start at 0.4 mg 4 to avoid precipitating severe withdrawal in opioid-dependent patients. Question 25. A patient with a known abdominal aortic aneurysm, AAA, presents with sudden onset of severe back pain and hypotension. What is the priority action? Option A. Obtain a stat abdominal CT. Option B. Prepare for emergent surgical repair. Option C. Administer 4 fluids to restore blood pressure. Option D. Obtain a 12-lead ECG. The correct answer is option B. Prepare for emergent surgical repair. Sudden back pain and hypotension in a patient with a known AAA is a ruptured AAA until proven otherwise. This is a surgical emergency. Immediate surgical consultation is the priority. CT may confirm but should not delay surgical preparation. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding before surgical control. ECG is not the priority.